Majority MPs on the Health Committee are taking on former President John Mahama for describing the Agenda 111 project as unrealistic and overly ambitious. In a discussion with the clergy in Accra, the NDC flag bearer expressed skepticism over the feasibility of the government's Agenda 111 project. Chairman of the Health Committee, Dr. Nana Ayu, says John Mahama must leave such politicking to foot soldiers.
Of which he described the Agenda 111 project of government as over-ambitious and unrealistic. There are times that the minority, often than not, has made politics with Agenda 111. But we have taken it as politics as usual. We did not expect the list from the former president to join in the chorus of attacking Agenda 111. So if you call this as over-ambitious, if you call this as unrealistic, then it is a sheer attack on the manifesto of the NDC. That the NDC's manifesto was over-ambitious, unrealistic, full of lies and deceit. Because if you say what you mean, and you mean what you say, you don't forget it at any point in time. Your boys in your party would go and make politics out of it, but you, the leader, you don't go that route because of the manifesto. And if you see, we in the majority have always had this, and we said we'll allow the NDC minority to make their politics. But we would wait for the day that the leader would speak on this issue and we'll come at him. So, if you said you were going to do 88 hospitals, and MPP said was going to be 111, then what made this unrealistic and overambitious? The former president has been disingenuous. He has been inconsistent. Just saying things, just going away. We've passed that stage. We should be a bit scientific. We should mean what we say. And if you are not able to do it, doesn't mean when your opponent does it, it means it's not good for the country. We should go past this sort of politicking.
But the NDC MPs have been hitting back. Ranking member on the Health Committee, Kwabena Mensah Kando, says all the documents presented by government itself to the committee shows the project is not feasible.
Ladies and gentlemen, the presidency is not a joke. And therefore, as a president, when you speak, you must be as close as possible to the truth or the facts. We are all human beings. A certain margin of error is allowed. The president said that he tracked 111 hospitals, hence the name Agenda 111. Not 80 hospitals, not 40 hospitals. That he is going to construct the facts available to the committee support the fact that they cannot construct 111 hospitals before 2025. Number one, the whole project is estimated at 1.7 billion Ghana cedis. Take note of the figures. As at the last time the Agenda 111 Secretariat appeared before the committee, they had distributed or disbursed 251 million out of the 1.7 billion. So even the Agenda 111 Secretariat are complaining they are not getting source of funding. What they are saying is that they can finish 30% of the project in 2027 when His Excellency Nana Dankwa Akufo-Addo will not be the president of Ghana. They will finish the rest of the 30% after 2027. So why will a president go and give a promise that I will deliver 111 hospitals before 2025 and it is estimated to be completed after 2027? Isn't it overly ambitious? Sure. I mean, what has he said that is different from what they themselves have put on paper for us? So if you know, and I've told you that the presidency is not a joke, before you come out to do something, you must do the feasibility studies, especially when you don't have a reliable, dedicated sources of funding. So if you know you complete, let's say 40 or 20, what prevents you from telling us that this is what I'm going to do? Exactly. Why will you come and deceive the people of this country? As I speak to you now, we don't have a reliable or dedicated sources of funding for that project. So let us not shift the goalposts. Nobody should go and set his own questions and attempt to answer them. Lower the bar. Let us be within the context. What is President Mahama saying? President Mahama is saying that it is overly ambitious and unrealistic. What are they saying per this document? It is overly ambitious and unrealistic. Finito.